Hey there, I'm Dr. Aryan Malhotra and I'll be talking about 5 conditions for which bariatric surgery can be considered. Bariatric surgery, also known as weight loss surgery, is typically recommended for individuals with severe obesity who have been unable to lose weight through diet and exercise alone. So 5 conditions for which bariatric surgery may be considered are type 2 diabetes mellitus. Bariatric surgery has been shown to significantly improve or even resolve type 2 diabetes mellitus in many patients. It can lead to substantial weight loss and improvement in insulin sensitivity and glucose metabolism, often resulting in reduced reliance on diabetes medication or complete remission of the disease. The second condition is hypertension, or also known as high blood pressure. Obesity is a major risk factor for hypertension, and bariatric surgery can help reducing blood pressure in obese individuals. By achieving significant weight loss, bariatric surgery may lead to improvement in blood pressure control and a decreased need for antihypertensive medication. Hey, if you are exploring bariatric surgery, check out Mejo. We offer affordable treatment options in India, personalized quotes and second opinions from board certified doctors. With 24/7 support and seamless medical visa assistance, Mejo is here for your entire medical journey. Now let's dive into our next condition. The third condition is obstructive sleep apnea. So obstructive sleep apnea is a sleep disorder characterized by pauses in the breathing or shallow breath during sleep. It often occurs due to upper airway obstruction. Obesity is a major risk factor for obstructive sleep apnea, and weight loss can improve or even resolve the condition. Bariatric surgery may be recommended for individuals with severe obesity who have obstructive sleep apnea that is not adequately controlled with other mode of treatments. Next condition is non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a spectrum of liver conditions ranging from simple fatty liver to more severe forms such as non-alcoholic steatohepatitis or also in cirrhosis. So obesity is a significant risk factor for non-alcoholic fatty liver disease, and weight loss is an important component of its management. Bariatric surgery may be considered for individuals with severe obesity and non-alcoholic fatty liver disease to achieve substantial weight loss and improve liver function. Next condition is joint pain and osteoarthritis. Obesity puts increased stress on the joint, leading to joint pain and osteoarthritis, particularly in weight-bearing joints such as the knees and the hips. Bariatric surgery can result in significant weight loss, which may alleviate joint pain, improve mobility, and reduce the progression of osteoarthritis. It's important to note that bariatric surgery is typically considered for individuals with a body mass index greater than 40 kg per meter square or a BMI greater than 35 kg per meter square with obesity-related comorbs. However, eligibility criteria may vary depending on the individual circumstances and guidelines established by healthcare providers and bariatric surgery centers. So what are the types of bariatric surgery? First type we'll be talking about is Roux-en-Y gastric bypass. So this procedure involves creating a small pouch at the top of the stomach and rerouting the small intestine to connect to the pouch. So doing this, we are bypassing the rest of the stomach and the upper portion of the small intestine. Next mode of treatment is gastrectomy. In this procedure, a portion of stomach is surgically removed, leaving a sleeve-shaped stomach that is smaller in size. Gastric sleeve surgery reduces stomach's capacity, resulting in decreased food intake and earlier feeling of fullness. Another mode is adjustable gastric binding or lap band. So lap band surgery involves placing an inflatable band around the upper part of the stomach to create a small pouch and restrict the amount of food that can be consumed. The band can be adjusted by adding or removing saline solution through a port placed under the skin. Adjustment can help optimize the weight loss and manage hunger level. Next mode is biliopancreatic diversion with duodenal switch, or also known as BPD-DS. So BPD-DS combines aspects of both restrictive and malabsorptive procedure. It involves removing a portion of the stomach to create a smaller stomach pouch and rerouting a significant portion of small intestine to reduce nutrient absorption. Then comes the bariatric revision surgery. So in some cases, individuals who have undergone previously bariatric surgery may require a revision surgery due to complications, inadequate weight loss, or weight gain. So revision procedures may involve converting one type of bariatric surgery to another, or correcting issues such as pouch enlargement or band slippage. So what are the important factors that are taken into consideration to determine if bariatric surgery is appropriate for an individual? It may be body mass index, as I discussed before. It could be medical evaluation, in which patient undergoes through a medical evaluation to assess his or her overall health status and any other obesity related comorbs. It could be weight loss history. The patient history or attempt at weight loss through diet, exercise, behavioral therapy, and medical management is assessed. Another factor could be psychological evaluation. A psychological assessment is conducted to evaluate the patient's readiness for surgery, understanding of the procedure and its implication, and its ability to adhere to post-operative lifestyle changes. Another factor could be nutritional assessment. So in nutritional assessment, basically nutrition evaluation is done to assess the patient's dietary habits, nutrition status, and potential nutrient deficiencies. Then comes the risk assessment. The risk and benefit of the bariatric surgery are discussed with the patient, including the potential surgical complication, long-term outcomes, and the need for lifelong dietary and lifestyle modification. The decision to undergo bariatric surgery is made collaboratively between the patient and the healthcare team, taking into account the patient's preferences, values, and goals. Recovery after bariatric surgery is a gradual process that involves several phases, beginning immediately after surgery and continuing over the following weeks and months. While each patient experience may vary depending on the type of surgery performed, their overall health status, and any complication encountered during or after the procedure. So the recovery phase includes immediate post-op period, in which patients are closely monitored in the hospital or in the ICU setting or in the recovery area. Then the second phase of recovery is the hospital stay. The length of hospitalization varies depending on the type of bariatric surgery performed and the patient's recovery progress, but typically ranges from 1 to 3 days. During the hospital stay, patients receive education on post-op care and dietary guidelines. Patients are also advised against the activity restrictions and medication management. Then comes the transition to home. Upon discharge from the hospital, patients continue their recovery at home with support from family member or caregiver. Patients are provided with instruction for wound care, activity restriction, dietary guidelines such as progression from clear liquid to solid food, and medication management. Follow-up appointments. So, follow-up appointments scheduled with the surgeon and other member of the healthcare team are scheduled to monitor progress and address any other concern. Then comes the diet and nutrition part. So, gradual progression of diet is essential to allow the GI tract to heal and adjust to changes made during the surgery. Patients typically start with liquid diet, progressing to puree food, then the soft food, and eventually to the solid foods over several weeks. Nutritional supplements including vitamin, mineral may be recommended to prevent nutrition deficiency. Then comes the physical activity and the exercise phase. Light physical activity such as walking is encouraged in the early period of post-op patients to promote circulation, prevent blood clots, and aid in the recovery. Patients should gradually increase their activity level as tolerated, but heavy lifting and strenuous exercise should be avoided initially. Then comes the follow-up care. Regular follow-up appointment with the surgical team and other healthcare providers are scheduled to monitor weight loss progress, nutritional status, and any other complication. Long-term follow-up care is essential to address dietary and lifestyle modification. It is done to manage weight loss plateaus or regain and monitor for potential complication or vitamin deficiencies throughout the recovery process. Emotional support from family members, support groups, and mental health professionals can also be valuable in helping patient cope up with the physical and the psychological aspect of bariatric surgery and adapt to their new lifestyle changes. Compliance with post-op dietary and lifestyle recommendations along with the ongoing medical monitoring and support are crucial for achieving the successful long-term outcomes after the bariatric surgery. Ultimately, bariatric surgery represents a powerful tool in comprehensive management of obesity, offering hope and opportunity for individuals to achieve better health and well-being. However, it is important for patients to approach bariatric surgery as one part of holistic approach to health that includes ongoing medical care, healthy lifestyle habit, and a supportive environment.